So definitely, everybody, okay, make sure that you see this blood vessel. First, let's do the artery. This is aorta. This is the thoracic aorta. At the aortic arch, two branch off. This is left subclavian. This is the brachiocephalic trunk. Then give out the left common carotid, right common carotid, and the right subclavian. One more time, okay. At aortic arch, for the ming, only two branch, left subclavian and the brachiocephalic trunk. That brachiocephalic trunk give off the left common carotid, right common carotid, and the right subclavian. Feel comfortable? Yes, right. Exactly as I drew for you. You can put the that my picture or my drawing over there. Seeing the if it's right or not. So please name it.
Left subclavian. Common carotid.
No. What it is? Cephalic full name trunk or trunk.
Subclavian.
Common carotid.
Left common carotid.
Right common carotid. Right subclavian.
One more time, okay. Only one name, okay. If I hear more name, no, you need a
Subclavian. Brachiocephalic
trunk.
Common carotid.
Left
Common carotid,
Right common carotid.
and
right subclavian. Very good. Okay. Then go to the abdominal. This is an even bigger one. To make it clear, I cut this one off. You can see this is that abdominal aorta. Diaphragm, right? Below it is abdominal aorta all the way down. So first branch out of this one goes to spleen. Can you see the spleen, stomach, and the liver? What's this branch is?
No, cephalic.
Celiac trunk. Celiac trunk. Then second branch out of it, superior mesenteric. You can see all the small intestine here. Superior mesenteric. Still follow? And then renal. You can see renal. It's the ones underneath it. Can you see? That's the one goes to the what? Kidney. That's renal. And then last one go to the distal portion of large intestine, inferior mesenteric. So abdominal aorta, celiac trunk, superior mesenteric, and then renal artery, and then inferior mesenteric.
Why isn't that one blue?
Which one blue?
Like this, it doesn't have to be.
Which one blue? Nothing
This one.
blue. Which one? This is another vessel. That's inferior vena cava. That's we look at this one, artery one, right?
Okay.
Those vein, look here. This is what the inferior vena cava one is
Okay.
another one. Okay, and then go to what? Go to the pelvic cavity. You can see four branch directly off that abdominal aorta. 1, 2, 3, and 4. This one external iliac, internal iliac, internal iliac, and external iliac. Okay, so one more. That's the best I can do for you. Look at here. Abdominal aorta, inferior mesenteric, abdominal aorta, external, internal, internal, external, directly off it. There is no water, common iliac issue. Okay, so this time you name it, please. Abdominal aorta,
Celiac trunk. Superior mesenteric. Renal. Inferior mesenteric. External. Internal. External.
yes. External, no common. external, internal,
external.
external. There is no comma.
Iliac.
Iliac artery. So we finish all the artery version. I finished all, right?
Okay.
So you want me go one more time or it's
Yes,
okay?
yes, 3 more times.
No, not 3 more time. Okay. This time, not this mink. It's this mink. So, 2 branch of aorta. Name this one. Left subclavian. Brachiocephalic trunk. Good.
Left
Uh-huh.
common carotid. Right common carotid.
Very good. Okay, very good. And then celiac trunk. Superior mesenteric. And then renal. Inferior mesenteric. And then external, internal, external. Very good. Artery finish. Then vein. Okay. Vein, you can see here, this is the heart. This is that what? Superior, superior vena cava and the inferior vena cava. Can you see? Heart, inferior and superior, right? And then on the side, can you see from my side? I open this one. Can you see? There is one up, join what? The superior. And this one receives the one from those intercostal vein. Can you see? These are the intercostal vein, and then drain into this one. This one join the superior vena cava. It's not the inferior vena cava. It's join the superior vena cava. What's this vein called?
Azygos.
Azygos. Very clear one, right? Very clear one. Can you see it? It's not. So look at here. So this is what? That azygos join the superior vena cava. Inferior vena cava is here. So to show the azygos, need to pull all the lung out on the posterior wall because it directly receives blood from intercostal vein. Intercostal vein is between those ribs, you know. So this is that azygos, and then join what? The superior vena cava. So one more time. You please name this vessel. What's this vessel? Yes. Inferior. What's this vessel? Yes. Superior vena cava. Then what's this vessel? Yes. Azygos one. Azygos one. Right? So then then the bottom one. Okay. The bottom vein, I need this one. Because you see I need what to cut. This is the inferior vena cava, right? And then this is that renal vein to the kidney, you can see, right? Very good. And then come to here. Right now, since I want to show you what the vein, so I will cut the what? Artery out. This artery you still can see, they all fall directly off that what? Abdominal aorta, right? Since I want to show you the vein, I cut this artery out, just for one side out. For the vein, this is that common iliac because here branch out. Let me show you. Can you see? Can you see? Can you see this one? This one is what? Stay inside the pelvic cavity. Then this one go out. So what's this one called? External. Then what's this one called? Internal. Then what's this one called? Common. Not this one. Okay, this one is go to what? Those reproductive organ. It's things here. This kind of branching. Can you see? Yes or no?
What is that?
Look at here. Can you see the branching here?
What is that?
This is common. This is internal. This is what? External part.
Okay.
This side, you see? Right? Yes or no? Seems that I don't feel that you get it. And, why not? Tell me, please tell me. Is it because too deep you cannot see? There is no way to break it anymore. you can clearly see here. There is one stay inside. There is one outside. So this is that common and then external and the internal iliac one. Okay, so I finish all the things. I'm going to bring that heart out and then